Hi, I am Candace Williams, and I will be doing my educational video on sexually transmitted infections, also known as STIs. A few learning objectives that I will be discussing in this video include what sexually transmitted infections are and how they are transmitted, where you can go to get tested, some of the barriers to STI treatment, and how you can protect yourself against STIs. What is a sexually transmitted infection? STIs are caused by a variety of pathogens that are acquired through sexual activity. This activity can be vaginal, anal, or oral. A few statistics on this. Chlamydia is the most frequently reported bacterial STI in the U.S. Almost 2/3 of new chlamydia infections occur among youth aged 15 to 24. It is estimated that 1 in 20 sexually active females between the ages of 14 and 24 have chlamydia. The Center for Disease Control estimates that approximately 820,000 new gonorrheal infections occur in the U.S. each year, and that less than half of these infections are detected. So how are STIs spread? You can get an STI by having intimate sexual contact with someone who already has the infection. They are spread during vaginal, anal, or oral sex, or during genital touching. So it is possible to get some STIs without having intercourse. Other ways that you can get an STI include through drug use, from sharing needles with someone who has the infection, or a mother can pass an STI to her unborn baby through childbirth. Some of the common types of bacterial STIs are chlamydia, gonorrhea, and syphilis. All three of these infections present little to no symptoms, and so the only sure way to know that you have a bacterial STI is through STI screening. For chlamydia and gonorrhea, if you were to have symptoms, you may have abnormal vaginal and rectal discharge, burning during urination, or for women, they may experience bleeding between periods. Gonorrhea also presents symptoms in other places in your body, including the throat, eyes, and/or anus. Syphilis has 3 stages, and each of these stages present different symptoms. Oftentimes they appear and go away on their own, so it can be hard to detect if you have syphilis without proper STI screening, but this is a curable STI. Some of the common viral STI infections out there are human immunodeficiency virus, also known as HIV, hepatitis B, and the human papillomavirus, also known as HPV. Most people will not have any symptoms of these viral STIs, and all 3 of these are incurable, meaning that you can receive medication for these to help treat the STI, but you will have these STIs for life. So where can you go to receive help? If you are in the Coles County area, you can visit the Coles County Health Department for anonymous HIV counseling and testing. They also test for other STIs. Appointments are necessary, and you can contact the 2 numbers that I've provided for you on this slide. Also, you can receive some additional information and help through the EIU Health Services. So I found a study on some of the barriers to STI treatment. So for the first one, risk and moralistic discourses in everyday life. Some of the participants felt that their sex education courses at school did not address their needs or reflected their personal realities, and so to them, they blew it off as not important. Number 2, safer sex is understood, but fear impedes STI testing. So having that fear instilled in you that you may have an STI that is incurable really made some people reluctant to go and get tested. Number 3, sexual stigma in young women's self-concept. So peers felt that they may be ostracized within their own social networks if someone found out that they tested positive for an STI. And 4, STI-related stigma and relationship conflicts. If their partner found out that they tested positive for an STI, it could potentially end their relationship. So how can you protect yourself against STIs? You can begin with educating yourself and knowing the risk factors associated with certain sexual activities. Change your behavior. Use condoms consistently and correctly each time you have intercourse or engage in sexual activity. Also, seek STI treatment. And that concludes my presentation. Thank you.